The main challenges in the diagnosis and treatment of NMIBC are the correct diagnosis and imaging from the very beginning, and also an accurate TUR in order to proceed to better grading and staging of the tumor.
The main challenges in treating non-muscle invasive bladder cancer are the multiple recurrences. We know this is a very common disease with a high prevalence, and this makes this disease the most expensive cancer disease of them all.
The main problems I face daily with non-muscular invasive bladder cancer is diagnosing the lesions. It's not always that easy to define malignant lesions and benign lesions. So it's essential to have a good visibility, good equipment to be able to see and differentiate the lesions.
The reason why I use NBI in my clinical practice is because it's very simple. It's just pushing a button.
NBI is easy to use. It's really accessible. So it's on the scope we use every day.
There are certain areas sometimes that might be difficult to interpret, and NBI assists in the interpretation. If we have a better imaging, which is NBI, then seeing more vascularization in certain areas that might attract our attention to that area that then finally is a tumor.
So NBI supports me in having better detection. Also, it supports me in having a better resections of the margins of the lesion. But most importantly, it detects carcinoma in situ. You can actually differentiate between edema and carcinoma in situ by seeing all these frog egg configuration, because the carcinoma in situ that you miss is the progression that you're going to have in the future.
I feel that I am able to identify more lesions, so it has impact, because then I'm not going to do a TURB for the patients. So it has clinical impact, what I see in the NBI.
Bladder cancer is the most expensive cancer disease to treat. We are obliged to reduce cost in every single way we can. One way to do it is just by using NBI, because you have it in your equipment already. So the new 4K camera head has outstanding image quality. Even in white light, the image is so fantastic. But also when you switch to NBI. And it's very simple, because you have the buttons placed in the camera head.
Using the new camera head from Olympus, you get everything in one. You're able to use NBI and PDD.
The other thing that is very nice about this camera head is that you have one button to do the autofocus. It's very simple, it's very nice, the image quality is fantastic, and it supports also with NBI.
Everything is in one system, which reduces the time, the operation goes faster, and you feel more secure. With the new camera head, it's easy to do a white light cystoscopy, use the NBI and blue light. In my experience, I've tried it on a couple of patients in Bergen. It enhances, there's more contrast in the picture, so it's going to be exciting to work further and get more experience with this product.
Advanced imaging technologies are going to allow us urologists to have better detection. Better detection means lower recurrences, lower progression, but also early detection. You might find smaller lesions that can be treated in the outpatient clinic, which is also a way to save money.
Related to advanced imaging and the future, of course, if we have a better imaging and definition of the bladder wall, of the vessels, of the tumor or suspicious areas, we will do a better job.